Hi, I'm Dr. Flores. I'm one of the San Diego Fertility Center doctors. I wanted to talk a little bit about what an IUI is. IUI stands for Intrauterine Insemination, and so it's a procedure where if you have a male partner or if you're using donor sperm, the sperm is actually washed, which is basically a way of saying that the sperm is prepared for an intrauterine insemination. So it's processed in such a way so that we just have concentrated sperm, the most motile sperm and the normal looking sperm in the sample as well. And it's placed through a tiny catheter into the uterus, past the cervix into the uterus, and then deposited at the upper half of the uterus. What that's doing is it's bringing the sperm closer to the egg. And so it may or may not also be combined with something called ovulation induction. That is a process where, for the female partner, she is given an oral medication that instead of just leading to one egg developing, which is what usually happens in patients who are ovulatory, we can actually get around 2 to 3 eggs to grow in a given cycle. This is usually done with monitoring, and so a patient would call with the first or second day of her period. She'd be prescribed this oral medication, and then automatically an appointment would be set up for a cycle day 10 ultrasound. Cycle day 10 meaning that if a period is considered day 1, 9 days after that would be day 10. Patients come in for an ultrasound and we look and see how the follicle is growing. So we don't see the egg because it's microscopic, but we see the fluid surrounding the egg. We call that a follicle, and as that fluid expands, it's usually a sign that there is a growing, maturing egg in that follicle. Once that follicle reaches a certain size, we then talk about giving a trigger shot. So that is a medication that will lead to the ovulation of that egg. Once we give you that trigger shot timing, we then will schedule the IUI to happen 2 days later because it takes 2 days for that medication to take the full effect and lead to the release of the egg. But that's something that you can talk more specifically about with your provider based off of your given diagnosis. The other option, rather than doing ovulation induction, is something called a natural cycle IUI. And so that's where, again, you call with your cycle day 1 or 2, but rather than starting an oral medication, we'll still bring you in on cycle day 10, but we want to see how your own body or your own ovary actually leads to follicular growth. But the rest of the process stays somewhat the same. So once the follicle again reaches a certain size, we have you take a trigger shot. That leads to the ovulation of that egg, and then the IUI process happens 2 days later. For patients who have a male partner, that also means that on the day of the IUI, or the day that the IUI is scheduled, the male partner will come in, usually about 2 hours before the female partner, and so that's so we can process the sperm. In patients who are using donor sperm, then usually the donor sperm is actually already in the clinic. We thaw that sperm sample and then again prepare it for the IUI process.